want them to have a voice to say, "What up, folks? I'm recording y'all now."
Okay, so I know I saw some folks are already jumping on. Welcome. We're going to give it a couple of more minutes before we actually start diving into the webinar.
Okay, I lost sound. Okay.
I can hear you.
Okay. Yeah, I just saw Kelly had muted her line. Mm-hmm. Such a pleasure.
Okay, Anita, would you like to start us off?
I am happy to. Good evening or afternoon, wherever you are at. I bring you greetings on behalf of the Positive Women's Network USA, and want to welcome you to our webinar entitled Ending HIV-Related Criminalization and Intersectional Solutions. We're really excited to bring this series, this first of a series of 6 webinars to you. We want to welcome you for being here. We have an exciting webinar plan for you. Just to start off, so my name is Benita Ray. I'm the Deputy Director of Positive Women's Network, but I want to just go over a few general rules. We have some exciting panelists you're going to meet in a moment. You're going to meet our exciting legal fellow who put this all together for you all, but I want to start off by saying this is an hour-and-a-half webinar. We're going to ask folks to keep their question and answers to the end. We're going to have a period for question and answer, but you are free to put any questions or comments in the chat box at any time, and we will take them at the end and go through as many as we can. So I want you to sit back, relax, and welcome.
Thank you. So as Benita said, she is the Deputy Director at Positive Women's Network. Benita is a member of PWN's Board of Directors. She was a member, that is, until she accepted the Deputy Director position. Benita has more than 20 years of experience working in underserved communities on social justice issues, including affordable housing, economic justice, healthcare, and HIV. So Benita, I'm very glad to have you as a co-moderator.
Yay, and so I have the pleasure of introducing my co-moderator as well, Kelly Flannery. Kelly is an If, When, How Reproductive Justice HIV fellow. She's working with PWN right now. Before PWN, she was a fellow at Human Rights Watch in the Women's Rights Division. Kelly graduated from NYU School of Law, where she was a member of the Reproductive Justice and New York Civil Liberties Union Clinic. And if, just in case you don't know who PWN is, I just can't imagine anyone not, I wanted to remind everyone what our mission is to prepare and involve women living with HIV in all of our diversity, including gender identity and sexual expression, in all levels of policy and decision making. We are a national membership body of women and people of trans experience living with HIV. We're founded in 2008 by a group of 28 women, all living with with HIV, very diverse women from diverse backgrounds. And one of our most important things is we are led by our constituency. If you know us, you know we are about the business of supporting women living with HIV. So I will turn it over to Kelly.
So to give you a little bit of context about why we're all here, after the 2016 election, PWN went through an intensive process, taking stock of the emerging needs of our members and broader constituency in order to help guide our advocacy well beyond this administration. It's clear that we were and are facing grave and increased threats to our health, human rights, and safety. In the midst of dangerous regressive policy attacks on the state, federal, and in some cases local levels, we've been fighting hard to maintain those policies that help protect our survival. But we also recognize that we need to do more than hold the line. We need to think forward beyond what's politically possible right now, because we're not going to be here for forever. So PWN used this as an opportunity to think about building new systems of power and pushing for progressive policy change that meets our needs holistically and equitably. We spent over a year taking leadership from women living with HIV and taking stock of the emerging issues that our members and listening session participants said most impacted their ability to live full, healthy lives with dignity and bodily autonomy. So it was through that process that we developed our policy agenda buckets and fashioned our updated policy priorities. You can see our 6 policy priorities here. Our 6 areas are ending criminalization, universal healthcare, economic justice, sexual and reproductive health, rights and justice, ending violence against women living with HIV, and trans rights, safety, and justice. So during this webinar series, we're going to introduce you to each one of those 6 buckets. We're going to do a deep dive into each priority area with experts in the field in order to provide you with the context and information that you need to engage in these issues in a way that's grounded in racial justice, gender justice, and reproductive justice. So to go over our objectives for this webinar a little bit, we hope that participants will leave with an increased understanding of HIV criminalization laws and their impact on our communities. We will learn about the harm reduction framework, increase understandings of laws and policies that target sex workers, and highlight policy solutions and actions that you can take. So right now we're here to talk about the ending criminalization priority area. In our ending criminalization priority area of the policy agenda, we elevate the problems of HIV criminalization, but we go beyond that to lift up the problem of criminalization more broadly. We recognize that HIV criminalization is a symptom of larger issues related to criminalization, mass incarceration, and to the maintenance of white supremacy and social inequity. If you follow the link at the bottom of this screen, you'll find our policy agenda. It includes our vision, the world that we're working towards by mobilizing around the policy concern that we'll talk about over the next 90 minutes, ending criminalization. You'll find an intersectional analysis of the current state of play, our progressive policy recommendations so that you can work to advance these priorities on the local, state, and federal levels. And you'll also find some important resources to further inform yourself. So I'd mentioned that in our policy agenda, we make concrete recommendations to state, federal, and local actors. Some of the recommendations to highlight here are removing the US entry ban on sex workers, ending the war on drugs and decriminalizing sex work, removing criminal penalties based on HIV status, adopting harm reduction policies, and eliminating felony disenfranchisement policies. Throughout the course of this webinar, you'll hear from our expert panels about what these policies are and why it's so important that we push for change. Another exciting development is that we're going to be releasing a new fact sheet in each of these webinars. So these fact sheets are intended to help guide your advocacy and inform people in your communities about the issues. In our harm reduction fact sheet, which we're releasing today and was created with the help of one of our presenters today, Monique, you're going to find information about what harm reduction is and what it looks like in practice. You'll learn about why it's so important to decriminalize, how laws that target sex workers also target communities that are disproportionately impacted by the HIV epidemic, and already over-policed, surveilled, and heavily criminalized. You'll find out more about how criminal prosecutions create barriers to accessing healthcare, employment opportunities, public benefits, and legal rights like voting. You'll also see that there are recommendations. We want to go beyond reacting to harmful policy attacks to continue pushing for progressive policy change. Even when the federal landscape looks bleak, we have real opportunities to craft policies that respect rights, health, and dignity on the local level. Some of the most progressive policy work is being done on the state and local level, where we see activists pushing for HIV decriminalization, sex work decriminalization, ending the practice of using condoms as evidence of sex work, adopting and funding harm reduction policies like syringe access programs. And so with that brief overview of some of the resources that will be available to you after this webinar, I turn it over to Vanita to talk about some of our amazing panelists.
Thank you, Kelly. So I do have the pleasure of introducing our panel today and really appreciate them taking the time to be here. So we're going to hear from Robert Suttle, who is no stranger to most. Robert is the Assistant Director of the SERO Project. Prior to joining SERO as its Assistant Director in March 2012, he was a case manager and prevention specialist at the Philadelphia Center in Shreveport, Louisiana, working with young African-American men who have sex with men. Robert was released from a Louisiana prison in January 2011 after accepting a plea bargain and serving 6 months for a conviction under Louisiana's so-called intentional exposure to AIDS virus statute. Robert was prosecuted after he and a former partner with whom he had a contentious relationship stopped seeing each other. The partner, who had previously threatened to file charges against Robert, then went to the police and did so. It didn't make sense. Next, I'm going to go to Monique, who is another person I know you all know and love. Monique Tula is the Executive Director of Harm Reduction Coalition, a national advocacy and capacity building organization that promotes the health and dignity of people affected by drug use. Previously, she was the Vice President of Programs with AIDS United, where she oversaw the grant making and technical assistance portfolio with more than 20 years of experience in the nonprofit sector. Ms. Tula has devoted her career to harm reduction advocacy and infrastructure development of community-based organizations. Oh my God. Magali Lerman, am I good? Pronounced she and they, is a co-founder and partner with Reframe Health and Justice, focusing on providing holistic harm reduction solutions to social injustices. She is based in Seattle, Washington, but is usually traveling for work. Previously, Magali has worked as the Drug User Health Fellow with NASDAD, Development and Volunteer Director with the Harm Reduction Action Center, and Director of Outreach and Organizing with TRACPUS. Their current contracts include stewarding leadership development with QTPOC, who use drugs in Michigan, working with a Massachusetts-based abortion fund to institute a racial justice infrastructure and advancing pre-booking diversion programs in the Mid-Atlantic. Magali is also the board president of the Sex Workers Outreach Project USA. She loves oat milk lattes, long walks on the beach, and is obsessed with their cat. So the speakers, I hope you join me in welcoming our speakers, and they will, they know the order that they'll go in, and I will come back on the other side. Y'all take it away. And thank you again.
Thank you so much, Vanita. And now I leave it over to Robert, who will talk to us a little bit about HIV criminalization. Thank you.
Thank you, Kelly, and thank you, Vanita, and thank you, PWN, for this opportunity to share about this experience around HIV criminalization, and I'm happy to share this panel with Magali as well as Monique. So I'm just run right into it because I don't have a lot of time, but I'm glad to know that PWN will be providing a lot of resources that people can have access to after this, this and the rest of the series webinars are presented. So 10 years for me, it has been since I experienced this phenomenon called HIV criminalization. However, at times it still feels like it was yesterday because this issue is still something that, or this phenomenon is still something that's so present and so real, and especially as I see more and other people are continuing to be prosecuted each day, whether we know about them or whether they're reported cases or not, but it is still something that is still happening. And that's why things like this is very important for people to plug in, to know what it is, how it's still happening, and what's being done about it. So HIV criminalization is a phenomenon that happened by the enactment of laws back in the late 80s and 90s when HIV was considered this, dangerous epidemic. And so legislators created these laws that they felt would be instrumental in deterring the spread of HIV or the transmission of HIV. And for years, or at least for decades, these laws have kind of went under the radar. And so today, a lot of people are not familiar or not familiar with the phenomenon of HIV criminalization, or even that there are specific laws that are specific to HIV and to people living with HIV. And so this is something that is very timely. It is an issue that I don't see going away because first people need to be educated just about HIV. And before we can even talk about HIV criminalization, and usually through HIV criminalization by someone case being put out in media is most people's introduction to HIV to begin with. So, so this is something that is very important, very timely, and I just feel like I can't stress that enough here. So what is HIV criminalization? It is the arrest, prosecution, and imprisonment of people living with HIV for what I believe is a perceived or an alleged intent to transmit the disease. Most people think that if a person is like being accused of transmitting HIV, that they're actually intending to do it. And that is so not the case. And there's many nuances to this issue. So HIV status, a person's HIV status is used as a basis to single out the people or the person living with HIV for punitive and what is also discriminatory treatment by our criminal legal system. It can occur under HIV-specific laws that, again, apply to only people living with HIV, or even under general criminal laws, where charges of punishments are initiated or heightened solely because of the person's HIV status. And so, and some examples of charges are reckless endangerment or even aggravated assault. But that depends on what state you're in. They may have different names, or the statutes may have different titles. The laws encompass non-disclosure status prior to consensual sex act, other modes of exposure such as to bodily fluids, for example, spitting. A person can become criminally liable, which we of course know that if a person is on treatment, they cannot transmit HIV, or HIV is not transmitted through spitting or by spitting or biting someone. Solicitation and needle sharing while positive can make you criminally liable and increase penalties for underlying sexual assault crimes. So again, that depends on, it varies from what state you live in, how that law is applied, and what the charges are. So where is HIV criminalization or the laws? They're everywhere. There are at least 30 plus states and even US territories that have HIV specific criminal laws, especially where the epidemic is increasingly heavy in the South, of course, and most of the southern states do have some form of HIV specific law on the books. Fortunately, there have been states that have since did some form of modernization or reform to their statute. For example, California just recently, Colorado, Illinois, Iowa, North Carolina, just to name a few. And hopefully there will be others soon in the coming, either this year or in the coming years. So what's wrong with this law? It creates a distrust of healthcare systems and legal vulnerabilities, which most people would think it'd be reasonable to avoid HIV testing, disclosure, or even treatment because of fear of HIV criminalization. So therefore, this phenomenon is contrary to public health goals. It doesn't provide any incentive for anyone to actually disclose their status, or even no incentive to really have these laws on the books to begin with. They, again, encourage people to not disclose and alienate people from seeking treatment or getting tested. The other points are it raises due process issues, meaning whether a person will have fair representation or even a hearing if they're considered to be found guilty or being accused of transmitting HIV. But what's unfortunate that in the court of law, there's no consideration of science. The science has advanced so greatly today than it has from the past. And unfortunately, that is not taken into consideration. And transmission is not even required for an indictment or even a person to be prosecuted. Intent to transmit is rarely even required or even considered. For example, so condom use or having a low viral load due to treatment is not even considered, doesn't even matter in the court of law, which it should, but it doesn't. And that's why our work is so important, to continue to drive home these inaccurate or these myths around HIV transmission or the real risk and routes of transmission. And then there's also negligible or zero risk activities such as for oral sex and spitting that are also criminalized. And it's difficult to prove that you actually disclose your status to someone. Most people think it's easy to disclose, and it's not. And until it's legally safe to do so, people won't be able to disclose their status. And most people think if a person's in the court of law that they must have actually done something in order to be standing before a judge or in the court. So therefore, people living with HIV have no credibility, and therefore it hurts their ability to have accurate representation or even a fair hearing based on that situation. And lastly, it inflicts serious individual and group harms. So who in the community does it criminalization impact? It stigmatizes all people living with HIV, people who living with HIV who are sex workers and who are drug users, people of trans experience, women, even young LGBTQ people, gay men. It doesn't matter. It stigmatizes all people living with HIV. And so some of those consequences, which are disproportionate punishment, may resort in secondary disclosure. At least that's what happened to me in my situation, that although I was being arrested for HIV, everything about my life came out in terms of my sexual orientation as well as my HIV status. And that information went out to family and friends. And so this is something that if it happens to an individual, it's not only just confined within that individual's life, it's also, the community and even the whole world, the city, knows about what's going on with that person's life. Some other consequences that can be used as a coercive tool by HIV negative partners. For example, having control over an individual, and if a person needs to leave an abusive situation or relationship, if that person's status is only known to that partner can use that person's status against them. Or even for a woman, have her kids taken away from her or anything. There's felony level punishment, which of course ruins people's lives. So most people are concerned about HIV being something that affects people's health and their lives for the long run. There is some validity to that, but also a felony, you carry that for the rest of your life, which of course affects your ability to find housing and a job. And on top of that, some of those consequences, it's social stigma, the constant threat of prosecution, lengthy prison sentence. Some people are serving 10, 20, 30 plus years in prison, or even been sentenced to 25 years in prison in some cases. And then life on the sex offender registry. 6 states have HIV-specific laws that may require sex offender registration: Arkansas, Louisiana, Ohio, South Dakota, Tennessee, Washington, just to name a few. And from my experience in Louisiana, they put sex offender on your driver's license. You have to send out community notifications to everyone in your community that you are a registered sex offender, and which exposes also your, that you're living with HIV and also what your charge is. And other punishments is the mental health challenges of dealing with the experience and then the collateral consequences that happen, that continue after that. So I'm probably running out of time, but I just wanted to touch on what the issue is and also to let you know how we're fighting to end it. So, there's this call to action by several organizations, as the Black AIDS Institute, Center for HIV Law and Policy, Counter Narrative Project, PWN, SERO, as well as the Youth is You or Prevention Access Campaign, have issued this call to action for racial justice in HIV criminal law reform, because we understand that the epidemic impacts Black communities and other people of color communities, and due to those disparities in the health system as well as the legal system, we can't just promote the fact that if someone has access to treatment and care and they're able to achieve undetectable viral load, that that those people should not be punished. But we should not forget those that are not able to achieve a viral suppression for all the many reasons that we're all familiar with in terms of disparities and the marginalization of these communities. And so we have to look at this from a racial justice lens to make sure that we are not leaving anybody behind and that we are reaching out within the margins where people are still facing these experiences and bring them in, and also by including their stories and having them involved in leadership, and therefore having the communities most impacted by the epidemic in leadership and decision making when it comes to addressing this issue from a racial justice lens, and also including this racial justice perspective in our organization and our political strategies, because we cannot do this work without being mindful of the communities in which it's impacted, and also having those communities involved, whether they're involved in our organization or at least doing some work with those people who are representatives of the communities and bringing them in. And some of that power that we build is through this first ever HIV is Not a Crime conference. We've had 3 thus far, where SERO has also partnered with the Positive Women's Network and have really developed and built a movement around the HIV is Not a Crime movement to address HIV criminalization on a national level. And also as a result of that, we've been able to develop state coalitions. There are several coalitions that exist across the country now than ever before, that are, some are organized and some are much further along, that they're now introducing legislation, which is a great thing. And so the movement has really built, and there's a lot of momentum built since I got involved in the work. And we could not have done this work without the stories of people who've been prosecuted, making this real and really dehumanizing this issue, showing people, just really what you go through, and not just hearing it sort of in an abstract kind of way. And through this racial justice lens, we hope to continue to work together with other people who are doing great work in other communities, because this work is intersectional, it's intersectional advocacy. And so there are states where some of us are working on HIV, and there are states where others are working on sex worker rights, and as well as for rights of people who inject drugs for harm reduction and so on and so forth. So this webinar is very important so people can understand what's going on in other states and figure out ways to strategize and try to work together, because we are all in this together, whether you are HIV positive or not. We're all in this together because our communities are impacted. And so SERO has hosted several After the HIV is Not a Crime webinar series. So there's ways to get this information. You can contact SERO at info@seroproject.com, and we'd be glad to provide whatever resources that you may need on our end, as well as or direct you to other organizations or partner organizations that are also involved in this work that will have the answers. So I'm not sure how much time I have left, but I'm going to stop right there, but I'm happy to answer any other questions at the end of these other presentations. Thank you.
That was perfect. Thank you so much, Robert.
Hey.
And you're right. I think that part of like the real force behind a webinar like this is pulling together those intersections. And with that in mind, I'd like to turn us over to Monique to speak from about some of the work that the Harm Reduction Coalition is working on. And yeah, I'll let Monique take it from here. Go ahead. Oh, you're still muted.
Sorry about that. So thank you. And I guess first off, I just want to say, I just want to give mad props to PWN for pulling this webinar together. I'm so impressed with all of the work that y'all have been doing over the last couple of years, and really think that you all are setting the standard for not just HIV advocacy, but advocacy in general. So I'm just really pleased to be part of this. So I've been asked to talk about HIV criminalization through the lens of substance use. And quite frankly, I can't do that without naming the fact that by design, the criminal justice system perpetuates structural violence against some of our most vulnerable communities in the US, and I mean poor people and Black and brown people. So I'm just gonna be saying next slide, Kelly, so next slide. So just a for folks who don't know, Harm Reduction Coalition, this year is our 25th anniversary, and we were founded by a group of visionary people who made the bold decision to care and advocate for people who use drugs, who at the time were dying from AIDS. And so over the past 25 years, we've grown into a really robust network of harm reduction advocates and providers and people who use drugs themselves that spans the country. And in fact, we have a global contingent as well. And our work is to advocate alongside and on behalf of people who use drugs. So the way that we do that is to provide training and technical assistance to capacity building organizations, health departments, municipal leaders, policymakers, medical professionals. We also publish a great deal of literature and material about how to manage drug-related harms like overdose, HIV, Hep C. And we also, some of you may know, host the largest conference in the world every couple of years that is focused entirely on harm reduction. And in fact, just last October, we had more than 2,000 people join us in New Orleans to share and build with each other. Next slide. So briefly, what is harm reduction? So when most people talk about harm reduction, it's often limited to a public health framework that, that focuses on practices aimed at reducing risk, right? So risk for HIV, risk for viral hepatitis, risk for overdose. And so we've been beginning to think of this as harm reduction with a small h and a small arm. And so what we mean by that is it's really, this is the practice, right? It's the practice of reducing harm. So interventions like syringe access programs or using naloxone to prevent an opioid overdose, or medication-assisted treatment like methadone or buprenorphine. PrEP and PEP are versions of harm reduction. Stable housing is a form of harm reduction. And so the role of the harm reduction practitioner is just plain and simple. It's to help people get access to the resources that they need. And the way that we do this is also simple. We just ask people what it is they want, right? And then our work is to try and help them get those needs met. We do not judge people for what they do. We don't coerce them into doing something that they're not ready to do. We remain neutral. We remain aware of power dynamics inherent in this sort of client-provider relationship, right? We respect people's autonomy and ability to make decisions for themselves. And we respect the fact that when people don't get their needs met, they often struggle to get their needs met. And, you know, also the reality that many of the folks that we work with are often in the midst of traumatic events or have experienced them in the past, which often informs the decisions that they make. So harm reduction is about meeting people where they're at, but not leaving them there. So that's the practice. But harm reduction with a capital H and a capital R, we think of that as the movement itself, right? And it's a movement that is based in a political liberatory framework that shifts power and resources to people most vulnerable to structural violence. And this framework, 25 years ago, grew in direct response to the fact that people who use drugs were rapidly acquiring HIV and dying from AIDS at the beginning of the epidemic, but there was really little political will or resources to do anything about it. So harm reduction with a capital H and capital R resists punitive and cognitive strategies that deprive people of agency and autonomy and basic human rights and freedom. It challenges stigma and social exclusion by building a community of people where we offer people who use drugs a sense of place, a sense of purpose, and a sense of participation, things that I'm sure that the members of PWN are very, very familiar with. It's one of the reasons that you all are so successful. You have a sense of place, you have a sense of purpose, and you have participation, widespread participation. So, you know, harm reduction is, again, it's about shifting power and resources to people who are most harmed by structural violence. And the way we do that is to change conditions of access. We dare, right? We dare to see people who use drugs as whole people who are deserving of love, care, autonomy, and who have, possess the agency to care for themselves and their community, especially those who are in the crosshairs of harmful drug policies. Next slide. And it's really this last piece that drove us to launch our North Star statement almost a year ago. And that is Harm Reduction Coalition creates spaces for dialogue and action that help heal the harms of racialized drug policies. And we break that down into three essential components. So the first is to create spaces for dialogue and action. And that compels us to play new roles as conveners and facilitators and coalition builders. That moves us beyond our traditional core activities that are primarily focused on reducing risk, right? The call to help heal the harms, that makes explicit a broader vision of harm reduction, again, that extends beyond traditional practices, HIV prevention and Hep C and overdose risk reduction, but pushes us toward reparative strategies that address trauma and social division and injustice. And then lastly, we name racialized drug policies as the nexus of damage and threat to all people who use drugs, regardless of race. Because drug policies in this country and most others have never been race neutral. And from their origins, they've targeted immigrants and people of color. And even though recently we have this sort of shift or turn toward public health strategies that are spurred by compassion for white folks who are caught up in the opioid crisis. And that's just emblematic that, another example of, the fact that our shifting responses to drugs and people who use them have always been intertwined with race. Next slide. So, okay, well, who's affected? About 30 million Americans report using an illicit substance in the past month, just the past month. And that doesn't include alcohol or legitimate prescriptions for pain medication. So imagine what happens to those figures when you include legitimate prescriptions. People who use drugs are still among the most vulnerable groups that are affected by HIV and Hep C transmission. And despite a steady decrease or decline in HIV incidence rates among people who inject drugs, the prescription opioid crisis is now driving those numbers back up, right? And it's placing new populations at greater risk. There are social and economic factors that limit access to HIV prevention and treatment services among people who inject drugs. And in fact, there was a study of cities with high levels of HIV and more than half of people who inject drugs who are HIV positive, more than half reported being homeless. About 16% reported having no health insurance in the last year, and about 25% reported being incarcerated in the past year. So I just want to be mindful of time. I could say much, much more about who's vulnerable, but I'm going to ask you to advance to the next slide. So despite a decades-long massive display of force, primarily in the poorest communities of the US, we are still the largest consumer of narcotics in the world, right? So the US makes up just 5% of the global population, but according to most estimates, we account for over 25% of the global demand for illicit drugs and 25% of the world's prison population. Drug policy in the US is largely based on this idea that restricting the drug supply through interdiction and criminalization will alter the demand of drugs. So in other words, strict enforcement and punishment of people who use drugs would reduce personal drug use, right? And consequently the demand for drugs. And in fact, the term war on drugs was coined in the early 70s by Richard Nixon. And again, he directly targeted drug consumers, right, through this strategy. Next slide. And there was an insidiousness about, behind these policies that really demonstrates how governments create and perpetuate structural violence against Black and brown people and poor people and immigrants. So the Nixon White House had two enemies. There was the anti-war left, right, anti-Vietnam, and then Black folks, right? So think the post-Black Panther environment, right? So, but they knew that they couldn't make it illegal to be Black, and they knew they couldn't make it illegal to be against the war. So instead, they decided to get the public to associate marijuana with hippies and heroin with Blacks, right? And so that way they could arrest our leaders, they could raid our homes, they could break up our meetings, they could vilify us night after night on the evening news. And John Ehrlichman, who was Nixon's domestic policy chief, I've got this quote by him up on the screen, but he was also quoted as saying, "Did we know we were lying about the drugs? Of course we did." And it worked. Almost 50 years have passed since Nixon launched his war on drugs, and our communities are no better off than they were then. We're plagued by increasing social tension, poor health, violent crime, compromised civil liberties, and international conflict, and there are millions of Americans behind bar. Over nearly 5 decades, American taxpayers have dished out about $1 trillion on the war on drugs. And all that money has produced is the world's highest incarceration rate. It has not changed drug addiction at all. Next slide. So according to the most recent data from the Federal Bureau of Inmate Statistics, nearly half of all inmates are there serving time for drug offenses. And the Drug Policy Alliance estimated that when you combine state and local spending on everything from drug-related arrests to prison stays, the total costs add up to about $51 billion a year. And who is locked away is further evidence of America's racialized drug policies. Next slide please, for more than 20 years, the largest group of inmates in federal prisons are there for drug offenses, and that eclipses the percentage of people who were convicted of homicide and sexual assault and weapons offenses or burglary. Latinx folks account for more than 32% of the entire inmate population, but represent less than 18% of the nation's population. And Black folks comprise nearly 40% of inmates, although we only represent 12% of the US population. Next slide. And some of you may be familiar with Michelle Alexander and her book, her 2015 book called The New Jim Crow, she's a legal scholar and theologian, and she, in this book, compellingly described the vicious assault on communities of color that was waged in the name of the war on drugs. And, you know, she describes the myriad of systems that are all working together that are designed to keep what she calls commodified bodies churning through the prison industrial complex. And she calls this slavery by another name. Next slide. And so not only is the war on drug an abject failure, but today we're more reliant on prescription medication than ever before. We take more illicit drugs than ever before. We're living in an era where the rate of people who have experienced intergenerational trauma and poverty and social isolation and homelessness and untreated mental health issues are turning to drugs to cope. And now the drug supply is more dangerous than it's ever been. You can't watch the news or scroll through social media feeds without seeing another drug death or death to an opioid overdose. And despite just, you know, being told to just say no, we're bombarded with these images, with these messages to take a pill for whatever is ailing us. You know, we even listen to, like, if you listen to the radio playlists, right, they're filled with songs about popping pills and feeling like rock stars. And these are songs that my 8-year-old grandson and his friends, you know, sing along to. Shout out to my 8-year-old grandson. But I'm worried about him, and I'm worried about his friends. Next slide. So this shift from prescription opioids to heroin is easier than you may think. Heroin is often easier to get, it's cheaper, and depending on the quality, it's more effective. Heroin use in the US has increased almost 5-fold in the past decade, and this time it more visibly cuts across all social groups and ages and genders and, yes, race. And that's evident in the media's fascination with the white prescription opioid and heroin user. Next slide. So I want to be clear that reducing these disparities is not going to be accomplished just by increasing the rate of white folks who serve time for drug offenses. Like, that's not what's going to fix it, right? Because there's plenty of white people who are as much victim of the drug war as Black and brown people. The average life expectancy for white American men without college educations is declining for the first time in 100 years. And what's killing the white working class is not diabetes or heart disease, it's alcohol-induced liver failure and opioid addiction. So for white working class guys, things ain't looking so good. So these disparities in drug arrests and healthcare and where law enforcement agencies focus their attention, they reflect a complex history of complex political and criminal justice and socioeconomic dynamics that are plagued by racial tension. The war on drugs at its core is perpetuated by a capitalist, misogynist, racist, and implicitly biased structure that harms people and violates our human rights. Our criminal justice system is designed to set people up to fail and perpetuate modern-day slavery. And we need a fresh and evidence-based way of rethinking the drug war paradigm, because if we don't, we'll continue to repeat history. Next slide. So I want to leave you with something that I think that our friends in the public sector have actually gotten right. And so a few years ago, SAMHSA revised its working definition of recovery from mental health and/or substance use disorders. So they say that recovery is a process of change through which individuals improve their health and wellness, they live a self-directed life, and they strive to reach their full potential. Next slide. And so they break this down into 4 major dimensions that support a life in recovery. Health, so overcoming or managing one's symptoms and making informed and healthy choices that support physical and emotional well-being. Home, a stable and safe place to live. Everybody needs that. Purpose, meaningful daily activities, so a job, going to school, education, creative endeavors, but equally as important, the opportunity to you know, to have an income, right? And the resources to participate in society. And then lastly, community. So positive connections and bonds with other human beings, social networks that provide support and friendship and love and hope. Next slide. And I would argue that these are actually harm reduction informed dimensions that are not solely applicable to a life in recovery, but a life in general. So the harm reduction principles that you see on your screen, these were developed 25 years ago by and for people who use drugs. And at their core, they are people-centered, they are pragmatic, and they take into consideration really important sociocultural factors like race and poverty and social disapproval and stigma of people who use drugs. And lastly, what I want to leave you with is this idea, next slide, is that harm reduction is really a holistic approach, and that harm reduction models and interventions and the movement itself can be a pathway to personal responsibility and autonomy. And it puts the power of choice in the hands of people who use drugs. So syringe service programs and safe consumption spaces and MAT and PrEP and naloxone distribution, these are all examples of pragmatic and people-centered harm reduction approaches that can be really extremely successful at reducing people's risk. And these approaches create space for meaningfully engaging people who are rendered invisible or unworthy by society. Harm reduction demands that we view people as whole human beings worthy of basic human rights. Thank you.
Thank you so much, Monique. That was so powerful. I would like to now turn it over to Magali, who is the co-founder and partner at Reframe Health and Justice. So I will turn it over to you.
Thank you so much. And I just want to say to everyone so far, like, preach. It's just amazing webinar to be on. I also just realized that I thought apparently it was 2018 when I made this slide deck. So welcome to 2019, everyone. So I want to thank the Positive Women's Network. I mean, honestly, for just all of the work y'all do. I've been doing sex worker rights advocacy now for nearly 10 years and started in Denver, Colorado. And we worked with the Colorado Positive Women Network chapter to modernize HIV criminalization laws. Y'all made sure that we were at the table. And in fact, when I met folks involved in PWN Colorado, we were invited to come talk on something similar to this. And it was myself and a colleague, Chanel, who has been in prison for a number of years since then. And so I really just kind of wanted to dedicate this to her. I wish she was here alongside me talking to you all. Next slide, please. So I use she, they pronouns. My name is Magali, and I am a partner with Reframe Health and Justice Consulting. So we strive to shift current socio-political paradigms related to race, gender, and bodily autonomy. One of our specialties is sex worker health and rights, and we are actually one of only 2 national organizations that provide some of these services related to sex worker health and rights. So we do capacity building assistance, policy development and analysis, community-based research. We develop a lot of different content, write a lot of different things. We're really like thought leaders in a lot of areas. And then we do community engagement, community-based research, all those things as well. And so I really hope that you all will continue to look us up and work with us in a variety of different ways. Next slide, please. So this is a really ambitious agenda, I realize, for 15 to 20 minutes. So this is really just an overview of how criminalization of the sex trade really impacts HIV and all of the different populations that Monique talked about in her presentation. So just wanted to say that this is going to be an overview. Next slide, please. These are all the ways that the net of criminalization surrounding the sex trade works. And so it's really important to recognize that it's really not just the policies that are impacting people, it's also the enforcement of those policies, and then some of what Robert was talking about, all the collateral consequences that come along with that, right? And we're not just talking big P policies, like the policies that Congress passes, but also little p policies, all the regulations and the regulatory bodies that really impact people and put bans in different places that are really just based on stigma. One of the things that makes the direct laws and solicitation charges really hard is that they oversee and they criminalize the interaction between two or more people. And so it's really hard to just kind of isolate, say, something like drug possession. Like that really doesn't happen a lot in the sex trade, is that there are multiple parties that are being impacted all of the time. And what we've really started to see is a rise in third-party charges. And so that is where someone who is helping and assisting someone in getting dates, so that could be booking dates for them, that could be driving someone to a date to make sure that they're safe. There's a variety of different ways that that looks or works. Those people are now some of the most impacted by the ways in which the war on trafficking really mimics the war on drugs and is really just a war on sex workers. And so just to back up a bit, we see prostitution and patronizing charges, right? Those both actually fall under the name of solicitation, and those are really localized. Those are municipal laws most of the time, and so those vary from place to place. They could be widely different throughout a state. We really don't see a lot of states that have felony convictions for prostitution anymore. Florida is one of them, so there are absolutely some places that still carry felony penalties just for sex work and solicitation, prostitution in and of itself. But what we see is inflated jail times and lower burdens of proof in certain areas such as prostitution-free zones. And so that's what ends up happening there. And so there's lots of little workarounds that kind of inflate different charges and make it hard for people to exist. And these laws are very, very tied up with gentrification too. And so I really want to mention that, is that as gentrification, I think just about everywhere, right, accelerates, we see loitering laws get harsher, we see prostitution-free zones get harsher, and those sorts of things. And then there's patronizing. So that's the other end of the equation, which is where folks are purchasing services and buying sex. And there's pimping, pandering, and promoting, which are your third-party charges. So those are kind of like street-based management charges, or receiving any sort of benefit from the work of a person who's involved in sex work. And then there's trafficking. And trafficking is honestly a training all on its own, right? But what I will say about trafficking is that the elements that make trafficking are force, fraud, and coercion. Those are really, really hard to prove. And essentially, trafficking is a severe form of exploitation. Trafficking is honestly a consequence of capitalism, right? We see trafficking in just about every single industry, but the United States, because I think it has trouble talking about sex and has a lot of shame around sex, really loves to just like hone in on sex trafficking. There have been many reports that show that trafficking most happens in textile and agricultural industries, but what has ended up happening is that there has been a conflation of sex work and sex trafficking, because there's been this very strange marriage between conservative Christians and carceral feminists that essentially have said the sex trade is exploitative, and therefore everyone involved in it, all sex workers, anyone who sells sex is clearly a victim of trafficking, and anyone who buys sex is exploitative. And so it's put this very simplistic kind of moralistic view on the sex trade, and then policies start to follow suit around that. And I'll explain that here a little bit more in a bit. But there is absolutely a war on sex trafficking, which is a war on sex workers, right? It's disguised as a war on sex workers. and it absolutely mimics the war on drugs in the ways that it operates. But then we also see policing, right? And so these are some of the ways, again, that this mimics the war on drugs. We see asset forfeiture on the buyer side that looks like impounding cars. It was not rare when I worked at Praxis to have a lot of my clients come to me relieved that they were not arrested, but they encountered law enforcement who took all their money and then let them go. You want to know what they had to do? They had to go have condomless sex with clients, and they had to do riskier and riskier things just to be able to stay inside that night, or just to be able to take care of their kids or whatever, because cops had confiscated their money. Cops also confiscate condoms. They do all sorts of things with condoms because they say that they're evidence of prostitution, and they actually can be ticketably an evidence of prostitution unless your state's law says that they can't be. And so New York actually had a 5-year campaign to change that and make sure that it couldn't be. But in just about everywhere else, right, there's places where this is happening, and if it's not by law, it's absolutely happening in practice, and it's a huge know your rights issue. And so I actually had a contract last year where I got to do some community-based research with sex workers who use drugs in North Seattle. And this is absolutely something that happens still. People have been reporting in the last year, cops take condoms and poke holes in them. They said that they are scared of a wrap condom just the way they would be uncapped syringe. So it makes no sense at all, but it's something that happens. And so people, a lot of times it's more than 3 condoms is evidence of prostitution. And so people don't want to carry condoms. And then they end up in situations where they need them. Right? And so this is why PrEP is a very great intervention with folks in the sex trade, but it is one of the ways in which criminalization absolutely impacts leads to negative infectious disease consequences. And then there are incredible accounts of police harassment and sexual harassment of folks in the sex trade. People in the sex trade have no recourse, right, when violence, especially sexual violence, happens, and there's incredible power abuse that happens when encountering police. And in the sample that I ended up working with here in my research last year, 50%, 1 out of every 2, had experienced either severe physical harassment or abuse from law enforcement or sexual harassment, including it's actually a pretty common story throughout the nation that cops will arrest people, say that they will let them go in exchange for sexual services, and then still arrest them anyway. And so these are the things that are happening, and people can't do anything about because no one believes them. And there's all sorts of stigma. People say, oh, well, why does it make it okay to pay for, but not to have? Why is it okay to on Monday, Tuesday, and Wednesday, and not Thursday? These are things I've actually heard said to people when they try to go report rape or any sort of abuse that happens to them, either by clients or partners or police or social service workers, all sorts of stuff like that. And then there's also all of the things that come along with supervision, all the collateral consequences of convictions and some of the ways regulatory policies play out against sex workers. But I will be talking about that in another slide and want to be conscious of time. So next slide, please. So this, of course, is not a new story. The things that I'm saying are absolutely things that we have seen and heard before. And so as we see some successes in terms of drug policy reform and liberalization of drug laws, we see those same drug war tactics being used in the war on sex trafficking. And they're actually, I wish I really had a lot of time to go into this. I'm gonna write a blog, y'all, but I've actually coined something called weed washing. And so if you look at all of the places that have legalized marijuana, those are the places that have the harshest reactions and policies and enforcement of the sex trade. And a lot of the reason is because there's this anti-prostitution funder named Demand Abolition that has tons of oil trust fund money, which, like, the irony there does not escape anybody, I'm sure. And they essentially fund police and prosecutors' offices in places that have legalized marijuana to continue over-policing communities of color, because there are claims that lots and lots of trafficking is happening there, but it's underground. We actually have no good data on that because it's so underground. And then also all of the fines that the prosecutor's office is losing after marijuana has been legalized, they can just go make up by taking a harsher penalty approach to looking after the buyer side, right? And so I think Seattle in a lot of ways is ground zero for the ways in which the war on trafficking mimics the war on drugs. And there are, in fact, we were the first to have third-party charges. Just assisting someone with the knowledge of their sex work, assisting someone in prostitution gets you a felony, and there's mandatory minimums. And it's a $5,000 fine if you are caught patronizing a prostitute, and they renamed it from patronizing to sexual exploitation. So imagine having a sexual exploitation charge, but that is in fact one of the prosecutor's main priorities for the year is going after sexual exploiters. So so that's just an example of increased sanctions and the ways in which that dynamics the war on drugs. Criminalization of public health, also federal funding bans. Basically, these say that if you do anything to promote the legalization of prostitution, that you can't receive federal anti-trafficking dollars or international AIDS relief dollars. And so there are many ways in which this has created a monopoly of exit-based or anti-prostitution programs and approaches. And even though this was found unconstitutional, the anti-prostitution pledge in PEPFAR was found unconstitutional in 2014. There has been no regulation written on it, and so it continues in practice today. There's democracy for you. So we see also that these approaches have the same disproportionate effects on marginalized communities. The folks who are most impacted by the criminalization of sex work are women, are people of color, are people experiencing poverty, are transgender people. And you know, I think if anyone's familiar with Kimberly Cradshaw's concept of intersectionality, the folks who are killed the most in the sex trade are Black trans women, right? And so we know that people's identities and activities in the sex trade don't exist in a vacuum, right? People have other identities and experiences that they're bringing with them, and these overlap and create a lot of vulnerability. And HIV and infectious disease is just one vulnerability. Next slide, please. So this is one of the most popular abolitionist approach to the sex trade. It's called end demand, or the Nordic model, or the Swedish model, and that's because it started in the early 1990s in Sweden, actually as a reaction to a influx of Black immigrants that were going into the country. And essentially what this does is it applies economic principles to the sex trade, and these are just like economic product principles that say, okay, if there isn't demand for a product, the product will cease to be, right? And so then it applies these economic principles to people's lives, to social phenomenon, but you can't do that when social factors are at play. Tickle Me Elmo didn't come from generational poverty, right? You just can't do that. And so what that ends up doing is that it says, okay, we're going to further penalize Johns and clients, but we're going to take a hands-off approach to the sellers themselves. Again, solicitation charges are a crime of an interaction. And so what ends up happening is when you expand policing around one side, you're expanding policing around the other. And what this has led to is a lot of sex workers themselves getting trafficking charges that are felonies with mandatory minimums and those sorts of things. And when buyers are freaked out, essentially, there might be a need to have folks do more and more things for the same amount of money. People might want to have condomless sex, or it weeds out some of the good clients who actually are afraid of criminalization and those sorts of things. But the interesting thing about how the Nordic model is playing out in the US is that it doesn't actually follow the Swedish model, because the Swedish model fully decriminalized the seller side. And there's actually a bunch of reports by the Global Network of Sex Worker Projects that show that this actually is still really bad for the seller side. People are like, we don't want partial decriminalization. decriminalization, but in the United States, this is the approach that some folks are taking, but it doesn't decriminalize the seller side. So what ends up happening is that there's kind of like this handoff approach to the seller side that has no accountability and no protocols, and we actually have no clue what's happening, and people are still reporting that there's lots of harassment and all of that because there's just no oversight. And so in a lot of ways, this is really, really tricky, and this is what we are fighting against, because again, it's this idea that all buyers are like evil people and all sellers are just victims. But this end demand is what has created a lot of the policies recently that have had the most negative impact on the sex trade, and on people's health who participate in the sex trade. Next slide, please. And so we know, of course, that their criminalization has a ripple effect, right? It's not just the ways in which the actual laws and enforcement of laws play out, but it creates a stigma, which then creates a lot of social exclusion and problems with social institutions and a lot of isolation from social institutions. This includes denial of services because of arrest or convictions. Also, a lot of times, social services will say, well, we will take sex workers, they just can't do sex work here. Well, people are like trying to make money and survive. If they can't do sex work here, pay them to like be there, right? But so a lot of times people actually can't stay in shelters. They can't do a lot of things because they get kicked out for just trying to exist there, essentially. Also, not being allowed to report crimes, which is directly a result of the fact that their work is criminalized. Not allowing people to define their experiences, especially in accessing social services. So Monique talked about harm reduction services for folks who use drugs. There are absolutely a huge need for harm reduction services for folks in the sex trade as well, right? So essentially, this is an approach in which we work with folks in the sex trade in a way that is completely neutral to just uphold their health and well-being while they're doing the things that they need to do to survive and thrive, or whatever that really looks like, right? Well, all we really have in this country, except for about 6 individual clinics or drop-ins, is anti-prostitution programs or exit-based services, right? And we actually don't even have a lot of those. And so the interesting thing that ends up happening is that in order to get services, people have to identify as a survivor of trafficking. And so then the anti-trafficking movement can be like, oh, there's all these survivors of trafficking, which actually, like, there are, right? There are, because lots of people are experiencing these sorts of things, but people actually aren't kind of playing into this narrative that these services have. And so I think it kind of creates, like, if you want to get services, you have to say these things, and people who don't want to do that then just don't get services at all. And so that's really a problem. People know it's just a game, right? But people know how to play the game if they can. And of course, the people who really get the services generally are the ones who are lighter skinned and cisgender and those sorts of things, because of how reflective it is of the staff who work at these centers and those sorts of things. Also, we see discrimination in housing and refusing funding of programs, closing of bank accounts and crowdfunding accounts, PayPal, and seizing people's money. This happens all the time. And then after a big federal policy that passed last year called SESTA, which is a Senate bill, and FOSTA, which is a House bill, all sorts of things related to sex trade online are getting seized and shut down all of the time, because it criminalizes third-party hosts just for hosting anything related to the sex trade online. And then we know that there's incredible amounts of discrimination and a stigma that result in people losing their kids or getting fired, or those sorts of things that happen as well. Next slide, please. And of course, all of this really impacts people's health and general well-being. And we know that it's really intersectional. So here we'll see that 20 to 40% of women at high risk of HIV infection in the United States have reported exchanging sex for money or drugs or something of value in the last year. And I think that's actually probably pretty low. But we're talking about folks who are already experiencing poverty, right? Who are doing the things they need to do to survive. And of course, we know that there's structural factors and and that different work environments create different conditions, which is a really important thing to know, because essentially what SESTA and FOSTA did is it took the middle class right out of sex work, right? And so if folks can afford, they can go up to high class boards, which cost a lot of money. And so a lot of folks were pushed to the street. And I volunteer for an organization here in Seattle called the Safe Night Access Project Seattle. And we go out and we give out harm reduction supplies and socks and snacks and safety tips, and we distribute a bad date list to be able to keep people safe and those sorts of things. And after SESTA and FOSTA, there were 5 times as many people on the street, right? And what ended up happening is exactly what all the political people wanted to have happen, right? Is that it basically constricted the market and it dropped market prices. But again, there's social factors, so people aren't disappearing. They're just now in more survival mode, and they're now more vulnerable. And so the street price of a blowjob used to be $40 to $60, and now it's 10 to 20. And the people who are getting the dates are all the back page girls who have now come to the streets. And so the folks who are older, who are drug users, who are street-based, who have disabilities, the ones who are already more vulnerable to begin with, are the ones who now are like, their clients are gone and they're struggling to survive. So they're having condomless sex, they're doing really extreme sex acts, maybe they're doing drugs with clients where they weren't before. And so I was not surprised when about 4 months after SESTA and FOSTA was signed, that there was an HIV outbreak cluster here in North Seattle among people in the sex trade who use drugs. So you can't say there's causation, but there absolutely is correlation. And I know that there are others throughout the country that are happening just like this. Next slide, please.
Magali?
I'm almost done. Yes. 2 minutes.
Oh, yeah, because we're down to like our last 15 minutes. We just want to leave a few minutes for questions. So
yes. Okay, this is my last slide. I'm sorry to go over, y'all. I practiced this a couple times to try to get it not pithy.
It's also interesting.
So anyway, if there's anything I want to leave you with, it's that this is a really nuanced issue. And so I think that it's really, really great to support the decriminalization of sex work. And so thank you, public health, thank you, harm reduction, that because honestly, that actually hasn't happened for us in a long time. But to really be able to understand how criminalization is playing out in people in the sex trade, there needs to be a understanding of alternative approaches to violence that are non-carceral approaches to violence, and that really interacts with one of your upcoming webinars, right? And so it's really important to understand that to be able to get to the end of violence and exploitation and HIV among people in the sex trade, we have to be able to stop the acceleration of the war on trafficking. And so people really have to understand trafficking charges and all of that. And so to be able to do that, Swap Behind Bars does national training, Reframe Health and Justice does national training, and then Sex Worker Outreach Project USA is the largest national network of current and former sex workers and allies across the nation, has 27 chapters, and those are local chapters that may or may not do community-based education, but their website is www.swopUSA.org, and you can find a map there to see if there is any sort of group that can talk to you there. And that's my email address, so if you have any questions or anything, please reach out. Thank you so much.
Oh, thank you.
Yes, thank you so much, Magali. That was amazing. And I think the clear solution here is to just have 2 hours, 3 hours, a whole day seminar next time.
So now we've reached a point. I want to thank our presenters, Robert, Monique, and Magali. Guys have been awesome, and thank you. And now just to take a moment, there's a lot of information. If anyone has any questions, you have controls whether you can either raise your hand and Kelly can unmute your line. We don't have much time, so please, if you get unmuted, get to your question. If you want to put a question in the chat box or a comment, please do so, and we will read those too. We've got about 10 minutes here, so this was a great discussion. And let's see. Okay, I'm reading in the chat box. this looks like from our PETA. For anyone interested in operationalizing the intersection between harm reduction, syringe access, sex worker rights, and HIV criminalization, check out the toolkits at the Center for HIV Law and Policy and the National LGBTQ Task Force. And she's got the URL in the box, but I think anyone can see this, but the Center for HIV Law and Policy has some great resources, and then the National LGBT Task Force. Thank you for that, Arpita.
I have one hand raised, so I'm gonna allow someone to talk. Yolanda Ross. Are you there?
She's muted.
Yeah, she's muted.
Can you hear me?
Yes.
Hi, Monique. Thank you for that awesome presentation on harm reduction. So my question is, you're absolutely correct. When we do harm reduction, it's not to judge them. It's basically to meet the patients or the clients where they at, But do you see health professionals doing that? When say like when a mother is going for her prenatal checkup and the mother says, "Oh, I'm drinking 2 or 3 glasses of wine." Do you see that, and from your research, that they are doing harm reduction, or are they reporting the mother to agencies like CPS to report some type of harm? And that's what I have.
Yeah, thank you. That's a good question. And actually, one of the things that I just because I was trying to be mindful of time, one of the points that I wanted to make in terms of who's most vulnerable are, like if you're a parent who uses drugs, disclosing that or catching a case, right? So getting arrested, that often means becoming entangled with social services like, CPS or DSS, depending on where you live. And once you're in that system, it's hard to get out. So I think that there's sort of conflicting and competing priorities that, medical professionals who do not have a more nuanced understanding of the intersectional issues of their patients. If they do ask the question, that the solution is to invite some of these entities into this person's life. So like CPS. And I guess the other thing I wanted to just mention is my mother passed away in 2005, and she had been diagnosed with Hep C just 2 years prior. And she died from Hep C related complications. And the reason that I mention this is that she had a plethora of medical issues, meaning she was in and out of the doctor's office. And if you know anything about Hep C, in order to die from Hep C, you've got to have it for a really long time, right? And, she was never asked. She was never screened. So I think that, doctors have got, it's complicated for medical professionals. They've got a really short window of time. They're supposed to, sort of ask all the questions, including do you wear a seatbelt and, and whatever else. So the time to have a real conversation about a person's situation is greatly diminished. And, that's just reflective of the fact that our medical system, like so many other systems in this country, is utterly broken.
Thank you, Monique. I have one, and thank you, Yolanda, for the question. There's another question given by Jada. It said, is there any tracking done in reference to drug testing women that just gave birth and being reported to CPS? For example, the number of women reported, how many children taken away from the mother, et cetera. So is there any tracking, I guess, at the rate and how many children are being taken from a mother based on drug testing after giving birth?
That's a great question that I don't know the answer to, and I'm going to look at Magali to see if you might know. Yeah, but you know, we could look into that and get back to you and send it to the folks at PWN and try to get back to you.
That'd be great. Thank you.
So if anyone listening has a question, please feel free to raise your hand and I will unmute you so that you can ask that question, or drop it in the chat box, which Vanita is monitoring, and she'll let us know if there are any questions. I have a question for the group. So I'm wondering if you all can speak to, so we talked about the sort of plethora of systems that interact to compound oppressions, especially amongst vulnerable communities. I'm wondering if you can speak a little bit about how capitalism works, especially within the carceral system, and the criminalization of people living with HIV, the war on drugs, or the war on sex workers. I think it would be interesting to sort of dig into that as a huge overarching system that has structured our society.
I'll take the first stab at this. So capitalism, right, the way that it works is that it relies on an underground economy. It relies on being able to have a kind of a pool of workers that can replace other workers when they are concerned about their working conditions, right? And that creates an underground economy, right? And what then happens is to be able to control free market, to be able to allow free market capitalism, and to be able to contain power within free market capitalism, they criminalize underground economies, right? To be able to say, okay, here's where your money needs to flow, and there is absolutely the interplay of racism and classism and different things that are involved there. And I also think that it's really interesting, especially when talking about sex work, right? And you can think about drug use this way too, is that one of the ways, actually one of the, I don't know if anyone has ever read the five forces of exploitation, and talks a lot about how capitalism works, but exploitation is one of the cornerstones of capitalism, right? And so then it's really interesting that at some point we say, okay, this is a severe form of exploitation. This is sexual or other forms of labor trafficking, and how we're going to address that is with a violent and exploitative criminal justice system, right? But we need this criminal justice system to make money, right? It's a capitalist entity in and of itself, and specifically want to take Black and brown and poor bodies and make money off of those who we then need to siphon from that underground economy to make sure that we maintain power in this legitimate economy. And so it is not an accident, right? It is not an accident at all. And capitalism is, I think that's hard. Like when talking to people want to say, oh, you know, I think it's really interesting that all of these policies that to prevent trafficking or to end trafficking really just create them, right? But if you want to end trafficking, then like reduce poverty, end poverty, do universal basic income. So it's capitalism. So yeah, that's my response.
I'm sorry, I got a little excited over here and started knocking down stuff. I'm sorry.
I mean, I couldn't even add to that. This is why I'm like a Magali Lerman fangirl, because she's brilliant. What I would suggest is like make oh my God, why am I blanking? Michelle Alexander's book. I just talked about it. I like literally just talked about it. The title is
New Jim Crow.
The New Jim Crow. Make that like part. Thank you, Jenny. Also, but make that like a book club, you know, thing, because she breaks that shit down so perfectly. she breaks it down. Like, and she opened my eye. Like, if I thought I was woke before reading that book, like I was doubly woke, right? Like the point I was on cocaine like 24 hours a day after reading that book. You know what I'm saying? Like it's like really powerful. And that whole line, you know, the commodification of Black and brown bodies, that's really what it is. It is modern day slavery. There is a price on each one of our heads that if they can find a way to pull us into the system, they're going to make money off of us. And they have, that's the only way that they can perpetuate a capitalist system, right? Is to get free labor.
Yeah,
Okay, I've got
the words
of
Monique, I couldn't add more to what the two ladies have just said. And for HIV, I mean, it'd be great if they made a cure. I mean, these pharmaceutical companies are making millions, you know, in terms of medications and such. And I don't know how close they are to a cure. You know, I'm sure they're working on it or whatever the case may be. However, me coming from Louisiana, a state that has the highest incarceration rate in the world, you know, HIV, as I say, for Black people, in particular young Black gay men, also, you know, it's just another way to prosecute us. And hey, it's just like another way to make money, you know, or another, as Monique just said, to bring us into the system. Oh, they have HIV. Oh, we need to make a law for that. And if they violate, and then they want you to pay all these fees and fines, they want you to pay money that you don't have because you don't have a job. And as a way to also bring you back in if you cannot afford to, or if you violate yourself and don't pay fees and things like that. So it just becomes this endless cycle over and over and over and over again. So.
Wow, you guys, we could start a series here with this. I just want to read a couple of the last comments because y'all are off the chain here. Y'all know we had to do something when slavery, and I have air quotes, was abolished. What were we going to do to make, you know, you had to, you know, pay for labor. And so we had to come up with other systems in which to commodify bodies, Black and brown bodies. So I want to just read these. Arpita also says, also important to remember the concrete ways in which the law connects the criminalization of syringe access, sex work, and HIV. 12 states have a penalty enhancement for people living with HIV who share or sell syringes. 11 states have penalty enhancements for sex workers living with HIV, and 4 states have both. These are status-based enhancements. HIV status alone determines the enhancement of a crime, which is normally a misdemeanor or a felony. So that was one, and I got the last one. And this came from one of our young and up-and-coming baby advocates, and I don't mean baby because you're a baby, Deidre. I just mean it because you're younger than me. All that she's asking the question, are panelists willing to provide some virtual assistance to our ending criminalization efforts and over-incarceration efforts in Virginia on these intersections? And if anyone is on this panel that's willing to do that, if you reach out to me, I will connect you with Deidre, and there's a few others that we are kind of working with, doing some work in Virginia. And I just want to thank our panelists one more time and turn this back over to Kelly, because we could keep going on this.
Yes, I want to say thank you so much for this discussion. I learned an incredible amount, and I feel really energized from everything that you all said. I want to just show very quickly, we do have some PWN resources that I mentioned in the beginning. These slides will be available on PWN's website, so you can come here and find them. And we do have our next series, which will be on advancing universal health care, our next webinar in this series, I should say, and that will be on Thursday, February 21st at 3 p.m. Eastern Time, 12 p.m. Pacific Time. And there we will have Max Boyd, Candace Gibson, and Katie Robbins. So we're very excited for that. And this was amazing. Thank you all for being on the first webinar in this series. This was fantastic.
Thank you, Kelly. Great job.
Thank you, everyone.
Thank you.
Everyone be safe, and we appreciate you taking the time, and our panelists, we love you. Thank you so much for dropping so much knowledge.
Yes.
Bye-bye. Yay.
Okay. I believe I have stopped recording.